Okay, it looks like we have a couple of you on who registered, so we will get started here momentarily. Just want to introduce myself. I am Megan Dotson, and I'm the program manager for the National American Indian and Alaska Native Mental Health Technology Transfer Center. I have my colleague Kate Trams on, who is the website and communications coordinator for our staff, and then Pam Baston, who is our expert behavioral health trainer today. So we just wanted to be able to provide grant writing basically 101 to folks who really need it in tribal communities and those working within tribes. So we've done this a couple times, and Pam is an excellent resource. And so I hope you gain a lot of information with what we're going to share with you. I'm going to be on mute most of the time because, as you may hear, I have children here in the background currently who are in quarantine. So we will try and keep me quiet, and then Pam will do most of the talking anyhow. So with that, Pam, I want to thank you for doing this and welcome. I'll let you take it from here.
Okay, great. Can you hear me okay?
Yes, we can.
Wonderful. Okay. Hi, everybody. My name is Pam Baston, and I have been in the behavioral health, mostly substance use prevention and treatment field for 40 years. And during that time, almost all of those years, I have been a grant writer, maybe not the first 4 or 5, but other than that. And what I'm going to walk you through is the strategies that I use in grant writing. In the last 5 or 6 year period, recent period, I probably brought in about $100 million in grants using the strategies that I'm going to show you. There's probably no right or wrong way to do things. I'm just going to show you the way that I know that works. I try to keep things very simple and very straightforward. And I hope that this will work for you. I have been asked to provide this in kind of more of a basic approach. And I know we have muted microphones, I guess, until the end. So I don't know where anybody on this call may be, but we're also recording this for future playback for anybody who may have missed it. So let's see, why is it not moving forward? Hold on a minute. I think I have to just click anywhere. There we go. This is sponsored by SAMHSA, the Substance Abuse and Mental Health Services Administration, and we are with the American Indian Alaska Native Technology Transfer Center. So our objectives for this module, we'll have 4 different sessions, but for this one, we're going to really focus on what can you do before the grant actually hits the street. So when you're there in your tribal community saying, you know, we need so many different things, and I'm going to make up an example. Let's say we need all kinds of prevention services for youth, or we need a treatment program for parents or something like that. What can you do when you identify a need before the actual grant funding opportunity becomes available? When you've got a real pressed time frame to write in, we're going to talk about how you can prepare in advance for what you want funding for, so that you'll be in a better position to succeed with your request for funding. So we'll talk about those before activities. We'll talk about where to look for funding, and also we'll have a learning activity with a relevant homework assignment that you can do. You can make this course whatever you want it to be. It can be literally nothing more than you coming for the 4 different sessions and participating, or you can take it another step and complete some of the homework assignments that would enable you to get some private review time of some of your proposals. And that's something that could be very valuable to you in getting successful proposals. If you have a chance, if you sent it in, it would be something we could look at, give you some feedback on, and that would be part of this course. So it can be as little or big as you want in terms of the objectives of this course. So today, I'm going to go very quickly through slides 5 through 15 because we've prepared these as handouts. And Megan, can I verify from you, do you know whether the folks got their handouts before?
They
Um,
did. There was 3 total, and I did not send them the grant funding sources, so it's there in the chat right now.
Okay, wonderful. All right. So we're going to go first over the some definitions, and I'm not going to spend a lot of time, but I'd like to point out a few. You do have a handout with these on them, and also and there's a lot of information in this module today. Some of this we may just go over very quickly today, and then may drill down a little deeper later, and I'll point out when that is. So first, let's talk about the grant acronyms and terms. Because this is sponsored by SAMHSA, I want to focus on this one term here called FOIA, F-O-A, which is a funding opportunity announcement. These are just different examples of terms that you'll see associated with grants. And every funder has their own way of describing the grant application itself. All federal grants will probably use this catalog of federal domestic assistance numbers. That's just a grant number for each type of grant you might apply for. But under the CFDA on this screen where you see the FOIA, the KDA, and the ITN, those are, and there's a few more on the next slide, just the ways that different funders describe their funding opportunity announcements. I do want to point out that on this last one here, the ITN, which is some call it intent to notify, some call it intent to negotiate. What's interesting about how many of the funders use the term ITN is that rather than putting out a grant announcement that everybody and their brother applies for, and maybe they're not always on the right path of that, what that grant wants to fund, the intent to negotiate is a way where the funder will send something out and say, we're thinking about funding this particular thing. Why don't you fill out a 1 or 2 page little, sample of what you would intend to do with these funds if we fund you. And that way the funder can look through and say, oh, of the, hundreds of intents that we got, we're really only interested in these 30. And we're going to now ask that subset, or however many, 30, 40, whatever the number is, to come forward with a full application. What it does is it weeds out people from applying when they really didn't have the right thing to get funded, and saves them all the time from this excruciating long process. And it also helps the funder kind of zoom in on a smaller subset to concentrate on. As an example, all of the grants I've written over the years, I shouldn't say all, but probably 4 or 5, are always funded in the 90 points, 90 to 100, which you normally have to be in that range to get funded, or even maybe high 80s. One time I got more than 100. I got extra points for something, and I got like 103. So I thought, this is a slam dunk. I'm getting this grant. I got such a great score. And in fact, I was declined. And I was so stunned. And then I found out when I got a letter back that, well, we really got too many requests from South Florida, and we decided that's not an area of geography that we want to focus on now, so we're not going to fund you. Well, that would have been really nice to know if I had only had to submit a page or 2 of an intent to negotiate. But instead, I had to fill out this massive application process, get all the letters of collaboration, get all the attachments pulled together. It was weeks and weeks of effort, and then I didn't get it. So I think in part, this whole intent to negotiate or intent to notify, the ITN, is when they can cut down on the applications that maybe they really didn't want to fund it, and save you a lot of heartache from developing an in-depth application if you really weren't going to be considered. The last of these terms, notice of funding availability, and I think HUD uses the NOFA terms a lot. RFA, request for application, RFP, request for proposal, or SAO, supplemental announcement opportunity. Often the SAOs, the supplemental announcement opportunities, are if you're already getting funding for something and there's leftover money, and maybe there's not enough to fund everybody in your cohort, but the only people who might be eligible are those that already have it. So maybe you've gotten, let's say, a homeless grant or an HIV grant, and Maybe you've got a group of grantees that you work with that got funded right when you did. And you might get a shot at some additional money, and everybody and their brother can't apply, but those that already have that grant have a chance to pick up a little supplemental funding. So that's what that is. We like those because they're not very, we like those if you already have the initial funding, because it means you have a better chance at getting it. It's not super competitive. It's only applicable to that small group. These are just terms you can look up, again, on the handouts if you're not familiar. The main difference I want to point out here are usually grants are when you submit a proposal and a team of reviewers review it and they approve you. As long as you stay within that range when you implement, if you do what you say you were going to do, for the most part, most of the funders leave you alone. They might ask you for your reports every quarter or every year or biannually, but they leave you alone. But if you go back to this cooperative agreement, that's sometimes when the funder keeps their hand on the steering wheel a little more. It's a little more collaborative. So a grant is kind of, you know, take it, you kind of do what you say you were going to do, and pretty much folks leave you alone. Funders, cooperative agreement is where the funder really tends to keep their hand on the steering wheel a little more, and you have to negotiate a little bit more as you are proceeding. I'm not going to spend a lot of time on the rest of these terms. They can get rather complicated, but the definitions are there. The only thing I want to say about in kind is sometimes when you apply for funding, there'll be a requirement that you provide in kind funding or in kind funding would be like the value of funding. So maybe you put a facility you're not going to charge to the grant, and so you're donating or leveraging rather that particular resource. Or maybe you're going to have some of your staff spend some time with the project, but you're not billing. It's sort of when you're bringing other resources so the funder brings the funding to the table and you're bringing some contributions of your own in the way of services or personnel or facilities, things that kind of show that you're bringing something in. Also matching funds. Some funding opportunities require you to bring match. So they might say, we'll give you $200,000, but you have to put in, 10% match of your own. Sometimes funders don't make you match right away, but over the funding period you do. So maybe the first year you don't have to match, but the second year they want you to put a little bit of your own money in, and the third year a little more. And they move you to where you've got more of your money in than they have their money in. And that's a way to show that you're sustainable. Not a lot of folks just don't have the funds to match. And sometimes you have to match with dollars. Sometimes you can match with in-kind contributions. It depends on the funder and what the rules are. I do want to mention supplanting. This happens a lot where we hear people talk about, oh, I've got an outreach worker, and but I'm going to write a grant for a new outreach worker, and then I'm just going to cancel out my other outreach worker. Well, that's called supplanting. If you're already being funded to do something and that funding still is active, you can't go write another grant to do that same job that you're already funded to do. If, on the other hand, what you were being funded to do, let's say an outreach worker, was going to expire, let's say the funding was going to leave on September 30, and your new grant would kick in October 1, that's not supplanting. That's, you're losing a position and you're going to then try to gain it with the grant. But you can't just essentially replicate everything you already have funded and get someone else to pay for it. That would either be double dipping or supplanting. I'm not going to spend much time here other than to remind you that archival data is data that already exists. So when we talk about the needs assessment, or we talk about the statement of need in a grant, which we'll be talking about in a little bit, even though you may not have the opportunity to go out and get surveys done or to get new data in, you might be able to find archival data or data that exists somewhere else, like on a website or in a file cabinet or somewhere else, to provide that picture of what your needs are in your tribal community. And I also want to talk about focus groups. This is something that I do a lot, and I have gotten very successful with my grants. When I know that I don't have a lot of data for some reason, I'll go out and conduct focus groups. I'll find what we call key informants, or people that are in the know, that are very relevant on a particular topic, and interview them, and then collect all their answers and put that together in the way of data and information that I use in a needs statement section of a grant. So just because the data doesn't exist doesn't mean you can't find a way to get close to that requirement of showing a need. And we'll come back on that topic a little later. The Institutional Review Board, this is something that's very complicated. A lot of the work we do on SAMHSA grants, especially in the prevention area and some of the tribal traditional practices, do not necessarily need an IRB, but this is a case-by-case kind of thing you have to look at, but it has to do with if you're doing research with human subjects. And so when we deal with people, as we do in the human service field, sometimes the work that we do does fall under the need to have this board look over the data that you're going to collect and use, and have some rules around what you can and cannot do. And all that you need to learn about that is there. And you'll want to work with your tribal leaders and any evaluators that you might use through a university or other place to determine if you need an IRB or not. We do try to avoid them when we can, just because of the complexity, but sometimes you have to do it. Key informants, again, just people who are in the know. I was collecting data on drug use in a public housing authority, and they didn't have any data on drug use in public housing. So I went and met with all the resident managers, and they know exactly what's going on. And I asked them what was happening. I went to the police department that serviced that housing authority, and I interviewed them about what do they see with drug use and so forth. And I went to the local prevention and treatment programs and talked to them and put together a very compelling need that came from no formal surveys, no data, no nothing, just from interviewing key informants. And I'll tell you a few shortcuts as we get going. Needs assessment, just gathering all the data that you need in order to determine how, what you want to apply for, the funding that you need, the people that you'll focus on, or what we call your population of focus, and that kind of thing. And we'll talk more about that shortly. So here's another link that you can use to find out about other terms, or you can refer to the handout that I provided. And I want to stop there and first see if we have any questions about terms or any of the conversation thus far. And Megan, you'll have to let me know if this is something, do we open the lines or do we just wait and see if there's something in the chat box?
Right, so I had let them know a little bit ago that if they had any questions as we go, to please just ask in the chat, and then we'll read them out loud when we can interrupt you, Pam. And so far,
you interrupt me anytime you want.
Okay, so far no questions.
Okay. So now we'll move on to what we call pre-application activities. So rather than wait for the announcement has hit the street, funding is now available, and now you've got a fun-filled 30 days or sometimes 10 days. I mean, last year it was a nightmare how short the runways were to write these proposals. So my trick to writing proposals is write them before they even come out. And there's a lot of ways to do that, and I'll give you some information about that as we go. But one of the things that you want to do is learn about the funding opportunities that are out there. You want to have a pretty good handle on when do different funders put their funding out, so that you can kind of anticipate when that is, make sure you don't have a lot of staff out on vacation during that time, you know, or that you don't want to be gone then. This is, because this is again a SAMHSA initiative, I included their link to their funding announcements, and I'm going to show you two that came out today. But doing the research to figure out where funding is really key. Let's see, we move this over here. So you can see that this is a really good resource here, developing competitive SAMHSA grant applications. And the link is there. If you have not been through this document, I highly recommend that you check it out. It's very good. It provides practical examples, and the back of it has some really good tools and templates that you can literally copy and borrow and use and edit to meet your needs. And that's particularly, it also tells you how to register for the SAMHSA grant opportunities. So some funders put out what's called a funding forecast, where it will say, here are all the grants we anticipate funding based on funding availability. They always put that caveat in. So that's always nice. It doesn't always tell you when they're coming out, but it will tell you the topics so that you know, oh, we better start, doing some research now. We see there's going to be a homeless grant. Let's get our homeless data together. Oh, they're going to give an HIV grant. Let's see what our HIV prevalence looks like, or what holes or gaps do we have in services that we could help with HIV. So that's what the forecast kinds of things help you. You have the link to this handout, so I'm not going to spend a lot of time, but do note that in the handout as well, these are hot links. So you can literally just click on these and go to the funding sites. Grants.gov is one of your best bets right there. That pretty much has most, if not everything, you would typically want to go for in the way of federal funding. It won't help you for state, local, tribal grants. It will only help if the money is coming from the feds, including IHS. And then also the biggest umbrella funder for all the work that we do in substance abuse and mental health pretty much comes under the U.S. Department of Health and Human Services, which is this link here. So some of what I'm going to provide you is a little redundant. So for example, SAMHSA, it falls under HHS. And so you know a lot about that. And so does Administration for Children and Families. They fall under HHS. For whatever reason, a lot of substance abuse prevention and treatment programs don't understand that there's good funding opportunities right here at ACF. Some of these funds tend to be around child welfare, but some have to do with pregnancy prevention, homeless runaway youth, lots of youth services because it's children and families. But this is a really good resource and a lot of funding there. In addition to SAMHSA, that would be up the typical grantee interest areas. Department of Justice, and right now, under the Department of Justice, I believe there's funding out for rural communities for opioids, and there may be funding for Office of Victims of Crime, OVC, which comes, it's under BJA, Bureau of Justice Assistance. But all of these, this is something you just have to spend time kind of individually, going to these various websites and looking, because they all display it differently. They all show a different array of funding and detail. This is a surprising one, Department of Agriculture. If you're looking for telehealth opportunities, there's a lot of funding under the Department of Agriculture. I know that sounds counterintuitive, but at least the last 3, I think, or 4 funding cycles, they didn't even get to use all their money because they didn't have enough applicants. So don't hesitate to poke around the Department of Agriculture if you're a rural area, an agricultural area, or looking to do telehealth in areas that don't have good telehealth infrastructure, like the broadband technology, that kind of thing, because you might find some good opportunities there. And of course, the Department of Education for school-based programs. And then we've got the Indian Health Service. So all of these have links. All of these have suggestions of funding opportunities. So, this is the kind of thing that maybe you assign somebody on your team and you say, okay, staff member A, you take SAMHSA, check it out once a week, look for funding. Staff member B, want you to be riding herd on Administration of Children and Families, get to know that website, get to know where their money funding opportunities are, get to know what their priorities are. Maybe you assign different people, if you have the luxury of some staff, assign them the hunting opportunity of looking for these funding opportunities and to get to know the websites and the priorities. Again, the grants.gov will give you the broader overview, so you want to be going there at the same time. But this can be a lot of work, really delving into these websites and seeing what they have. Now, these relate to federal funds, but also there's a lot of philanthropy groups that are putting funding out. It tends to be much smaller. Usually the foundation grants are under 50,000, and sometimes they're just as much work as the ones for $1 million, you know, so who's a smart shopper? If you have the limited amount of time, you may want to focus on those that that have more of a funding amount. And I look at two things. I look at three things. I look at the funding amount to make sure the juice is worth the squeeze. I'm not going to put a lot of effort into something for $10,000. So I look at the amount. I look at how many will they award. And if they don't say how many they're going to award with the funding amount, sometimes they'll say, they won't tell you how much each grant will be, but they might say, we're going to spend $1 million and we're going to fund 10 grants. Well, maybe that means it's about 100,000, you know, times 10 grants is $1 million. Maybe some people might get more, some might get less, but it'll give you a ballpark. So you at least know, do I want to fool with this? Then I also look at the level of effort. How much work am I going to have to put in the time frame allotted to put together a competitive application? Not to throw something together and hope it sticks, but to put in a competitive application. And so that might, those three things are very key in the decision making. Now, to the extent that you can do the pre-work that we're going to cover here in a few minutes, and that you have what we call boilerplate on the ready, all there in your nice filing system, ready to be cut and pasted into your way to grant nirvana, then maybe you go for more, you know, of a risk. Maybe less, you know, the ones that you might normally apply for, you might feel like you're in a better position if you got to do some good pre-work. So if you know that there's a funding opportunity that you missed, either you missed the deadline or you applied and you didn't get it, but it tends to be one that recycles, comes through again and again. Like, for example, SAMHSA almost always has, every other year or so, you'll see typically a homeless grant. Every couple of years, usually you'll see a grant for HIV, Hep C, or other infectious diseases. You'll often see grants for specialty substances like opioid use or stimulant use. So if you know, and there's almost always ones for pregnant and parenting women and their children. So if you know, for example, that there is a topic like that that has been funded historically, maybe multiple times, maybe you missed it or you didn't get the points, then it might pay to do a little bit of investigation to try to find a successful application so you can compare it to the one you wrote, or, you know, at least look it over really good to see what did it take, what level of detail and what approach did the successful grantee take to get that funding. All of these grants are in the public domain, meaning that you can do what's called a Freedom of Information Act, or a FOIA, Freedom of Information Act, and ask for a particular grant. You have to ask by name. In other words, you can't submit a FOIA request and say, I'd like a copy of every grant that got funded in 2019 from SAMHSA for homeless. What you have to do is say, I would like a copy of the SAMHSA homeless grant for 2019 that was submitted by the Seminole Tribe of Florida. You know, of course, I'm making that up, but in other words, you have to be specific and name the grantee. How you do that is that, at least for SAMHSA, they have, and I'll show you some of these in a few minutes, they have not only the new funding opportunities, but they also have the archives of who got funded for every portfolio they've ever funded. So if you can just do a little snooping and figure out, well, who got funded, and then maybe you read through the little abstracts, a little synopsis that they give you, and you find 2 or 3 that maybe kind of line up with what you were wanting to do, or maybe the population you were wanting to serve, or maybe you line up on other metrics like your rural or your urban Indian or whatever you want to line up on that you think is relevant, and then you ask for those proposals. Now, it used to be you would get them within 2 weeks. That has not been the case that I'm aware of lately in the last few years. I don't know anyone who got any FOIA requests through quickly. I don't know why that is, or if that will change or what, but I do know that you have to pay a fee for the copying or whatever, or you used to have to pay like $1 a page. So, you know, it might cost you 30, 50, $100. You also I think they might not give you the budget. They might just give you the narrative, the grant narrative. The other might be considered proprietary. But either way, one of the things that I found that just blows people's minds, but I've done this over and over. I will go to the archive. I will find the grants that interest me. I then often will find the website of that grant writer, you know, that whoever wrote that grant, whatever organization. And often you can find a copy of the grant right on their website. Or you can Google the name of their grant and find it. Like somebody might have sent it to someone else, or they might have somehow it got out there, and there it is, you know, in the internet world. So just know there's many roads to Rome. If you're wanting to get a hold of a good example of a funded proposal, those are some of the strategies that I have used. And then obviously you don't want to copy what they did. You just want to understand how they wrote and what it is that got funding. And then also, I've been a grant reviewer. I learned more about writing grants by being a grant reviewer. I was absolutely blown away by what I learned as a grant reviewer. Used to be, we did these face-to-face. You would sign up. They would pay you some small fee. It wasn't very much. You have to take a day off work, and you would fly to, they would first send you a box of like 10 grants. You had to read them in advance. And then everyone else on the grant review team got their 10. And then they'd pull us all together in a hotel room somewhere, a big conference room. And then we would plow through them. And you would have been assigned, of the 10 grants I would get, on some of them I would be assigned as what's called the primary reviewer, and some I would be secondary, and some I would be tertiary. And if I was, whoever's assigned the prime review would have to stand up, make a brief presentation. This is by each section. You know, this applicant developed a statement of need. The need was very weak. They didn't include any data, or their data was 10 years old, or their data was statewide, and we have no idea how the need looks at the local level. Or you might say it's very strong. They did this, they did that, blah, blah, blah. And then I would sit down, and then they'd say, who has the secondary review of this grant? Whoever got assigned secondary would stand up and say, now I disagree with Pam. I thought this was good, and blah, blah, blah. And they go back and forth. And then they say to the tertiary reviewer, do you have anything to subtract or add from what you've already heard? And usually by the time they get to the tertiary reviewer, they are pretty much saying, no, it's all been covered. Or they might add a random comment. And then everybody in the team has to start assigning points. People that didn't even read it. I mean, technically they were supposed to have read it, but they may have read it, they may have not, they may have skimmed it, they may have read it, you know, on the plane and it's in turbulence, you know. I say this because you will see as we go forward in this course how important it is to use charts, graphs, very clever, simple, and compelling wording, because otherwise your grant will get just mixed in with everybody else's. They all start looking alike. After a while, it's easy for them to all blur. And you win or lose these applications sometimes based on one point. So you want to make sure that whoever reviews your grants really gets what you were laying down there, is picking up what you're laying down, and that it's very clear. That we'll talk about some strategies for that as we go. But being a grant reviewer helps. I also learned really innovative ways to format grants by seeing what other people did. I saw the value of charts and graphs. I saw I never knew things, for example, like you could turn the page sideways and not just have portrait size grant, but that if you had a certain chart that did better in a landscape view, that you could switch to landscape halfway, somewhere way through your proposal. So almost all my grant proposals are a combination of portrait and landscape because of some formatting that necessitated it being on landscaping. And there's a way to do that if you don't know how with a certain page break that I'll show you later. So any questions about funding so far in the chat box? Because what I'd like to do is take a minute to go through, I'll wait and do it in just a minute and see if one of my hyperlinks works. I want to show you how to do this, but I have 2 brand new grants that came out today that I added into this proposal. So trick question, when should you begin writing a grant? And a lot of people answer that we won't do polling with only a person or so, but basically they'll say when the grant announcement comes out, and au contraire, you want to do it the very minute your tribe identifies an unmet need or a wish list. So I always tell people, grab a yellow, some paper, like a pad that or a screen on your computer where you literally dump everything you ever need as it comes up. Anytime a client says, oh, I loved your program, it was great, I just wish it had transportation, or I wish we could have had a gender specific counselor, or I wish I didn't have to travel 20 miles for medication and that you offered it right here, or I wish we had, incentives that would have made my kid wanted to come more, or maybe I wish you had weekend hours, or whatever they ask for. Write it down, write it down, write it down. First of all, you'll use that information in very creative ways in certain places in the grant application later, which I'll show you. But you really want to start in this pre-work category. Usually you have about a 10-day to 6-week opportunity to write, and that's just not enough time. There are lots of websites to go through, like grants.gov that I already talked about. There's subscriptions that you can make. There are trade newsletters. There's one that I don't know if it's still out. It used to be called Substance Abuse Funding News that you can subscribe to. Some of these things are free. Some have a small fee. Some might be very expensive. But you can literally Google funding opportunity newsletters and find all kinds of letters, newsletters and websites and things that you might want to start frequenting and places you might want to start visiting regularly. You need to also be gathering any data for a needs assessment, anything that would prove the need that you are claiming you have. So we always have special files where we dump any data. Anytime you see regional data, local data, state data, national data, particularly about American Indian, Alaska Native. And I'll show you later how we can use national data to fit in a local area if you don't have local data yourself. News clips are good. You can't really use them as filler, like as an attachment, but you can certainly quote compelling quotes, and you can, reference news clips, especially if they have, any research or important citations that they're using. The most underutilized example that can really be compelling is letters from clients or community members. And this can happen when a program has a satisfaction questionnaire, and that at the end of that satisfaction questionnaire that maybe you give when a client leaves your services, and then it could say what services or recovery supports do you wish were available but weren't, or if you could have anything you wanted added to this program, what would it have been? So in other words, add a couple questions to any satisfaction questionnaires that you routinely send out. Because what that does is it tells the funder a couple things. One, that you cared enough to ask the people who received your services if what they got was valuable to them, if it was successful, if it was helpful, What else did they need that they didn't get that you will make an effort to try to find for them in the future? So it also can then be quoted. You can say things like 90% of all of the clients in our that receive services identified, residential treatment or housing as the biggest need that they could not meet. Or they identified, it's also good to ask what their barriers were. 57.5% of all of our clients identified these barriers as impediments to treatment success. So you want to ask, and that could be a whole other webinar about how to structure those, but they don't have to be fancy. The shorter, the better. You can just ask, less than 10 questions, 10 or less, quick and easy, and just do that of everybody who receives your service. And you might even do it at a midpoint of treatment, not wait to the end in case they drop out and then you don't have a way to contact them. But it's very important to get quotes. There have been so many quotes I have used from these things. Many times a parent will say, if it weren't for your program, I would not be alive today, or you saved the life of my child, or very, very compelling things that you then can quote in a grant that makes these things very real. So don't minimize that opportunity in pre-proposal times before a grant announcement is out to be really bolstering your capacity to gather key information and archive it, put it in files, have a really good filing system so that you can pull all this together very quickly. So these are the 2 grants that came out today, and they are due January 4th. Tribes are eligible as long as they are not a umbrella tribal organization. It has to be a direct tribe itself. I'm going to click on this hyperlink just to show you a little more about this. There's 2 of them. Now, and I hope, Kate, I might have to use your assistance here in seeing if I do this right and then navigating back to my my PowerPoint. But okay, so can you see this so far? Did my website, did it open up to the?
It did
SAMHSA?
not.
It did not.
No.
So then what I need to do is I'm going to go back to, let me see how I do this again. I'm going to go back to the share screen. I think this is what I did.
We can see your PowerPoint at the moment. So if you go, I think, is it Kate, is it right? You go to the upper left-hand corner to find the screens that are open.
Yeah, you may have to do like stop sharing and then go back and do share screen again, and then
That's what I thought. Okay. All right. So let's go do this. So we're going to go back to share screen. This time we're going to pick the mama. Which one are you? Which one are you? There it is right here, I think. Yep, this is it. Okay. Now did it work?
Yep, that looks good.
Yay. Okay. And by the way, are you seeing all the pictures of y'all on here like I am or no? Like you are, because it kind of, unfortunately, it blocks I'm going to put you way out there. No offense, anybody, just moving you over there. Okay. So when you click on the funding opportunity, you can see that this is the grant announcement right now. And you would see this is who's eligible. And it says here, tribes not operating under the umbrella of another organization. So you would be eligible. They're funding $950,000, so a little under $1 million, and they're going to fund 10. So that means it's about $95,000 per year for 3 years. You don't have to match, which is good, and you cannot exceed $95,000. Now, by the way, some funders, when they say that you're getting $95,000 or whatever your funding amount is, sometimes it won't say per year, and that might be the total award spread over the number of years that they are funding. In this case, that's not the case. You get, you get almost $300,000, about $100,000 a year for 3 years, $95,000. And then the states that aren't eligible, always look very carefully at the eligibility criteria, because Arizona, Florida, Georgia, Idaho, all these states in here, you are not eligible because if you've received funding in 2019 under that award. Now, what that's good about is if you aren't from these states, you might have a greater chance at getting these. And then also, it's very clear, I think there's something in here that says, oh, that to be eligible, you have to be a family-controlled organization, which probably means, yeah, you have to read this in more detail, but that you've got to be. And then what I want to show you is, I'm just going to click on this grant announcements while we're here. And I want to show you, this is, if you haven't been here, the SAMHSA grant announcement page. And then this is a nice archived webinar that can show you how to apply for things. This is what I highly recommend you do if you have not done this already, is you sign up for funding announcements. That way it always comes on your email and you don't have to do this Easter egg hunt that I'm fixing to show you. Okay, so these are, these are the 2 new awards right here. And then you can, you know, it tells you when they're due in January, and here you can get the actual applications. But what I want to show you is something I referenced earlier, and that is, I want to go back to the Grant Awards Archive. See right here, we're going to click on that. And this is where you can find copies of other people's grant announcements. So just for grins, we're going to go in here to the funding announcements of 2020. They might not have already made all the, let's see. So you see here where it says view awards, and is everybody able to see this okay on my screen so far?
You can see it, yep.
Yep. So let's just say, let's find a, let's see, let's find one that we know they've already funded. Let's find, I want to find the one that I work in, tribal opioid response. These are all the ones that have already, you can tell by looking here what date they were awarded. So these are all closed. But this also shows you what you might want to be ready. Like they always fund suicide grants, things like that. So there's lots of suicide grants in here. Ethnic minority grants, drug courts. I want to find, here's one. Tribal opioid response grants. This is one that I work on now. So I'm gonna, this was due in May, so they're already all awarded. I'm gonna go to view awards. And it's gonna take me to see who all got funded with this. And here, there will be 100 that I can read through. And this is just, and it's also good to see how people summarize their grants. And this shows all, these are all tribes. This shows how much they got, shows who to contact, and it shows, this will go on for, I think, 100 different grants. And what you can then do, suppose you read one of these little summaries and you say, oh, I like that, I want to learn more about that. You can either contact the grant themselves and ask if they would share a copy, which they may or may not, or you can Google. I could then put this, Indian Health Council, Inc., and I can put it, you know, and I start Googling till sure enough, I may find a copy on my own that somebody put on a website somewhere. So that's that. Okay, now let me see, how do I do this? Okay, so now I'm gonna go back and I'm gonna go come to mother. I go, what do I do here? View right here. Okay, now I'm going to stop sharing and I'm gonna go back to my PowerPoint. And then I'm going to go share screen and I'm going to pick on this. Okay, so that was that particular grant. Now there's also another one, and I won't go to this level of detail, but it's the same. You would go through the same exact process. This is for a statewide consumer network program grant. And this is the same thing. Tribes are eligible, but not if you're a tribal organization. And you have to show that you've got a lot of consumers involved in your program. Consumers being people who have had a substance use or mental health history. So you'll have to, this is due in January, you'll have to read if you're eligible. But that hot link is there as well. So we've already talked a little bit about consumer client satisfaction surveys that you really should be gathering if you don't already. Document any innovations or creative ideas that people might have. If you're in a staff meeting and someone comes up with a great idea and you don't have time to write about it, put it on that pad that ongoing dump list that you have, that you will keep in your grant writing folder, because it might be, if you don't write it down, you may forget about it, and it might be just the kind of innovation that you want to explore later when there's funding. And then also sample budgets, sample job descriptions. I have taken hours and hours and hours of time to create really thoughtful job descriptions, which you can download free from the Tribal Opioid Response part of the website of the American Indian Alaska Native ATTC. So under that University of Iowa AIAN website are lots of different programs: mental health HTTC, prevention TTC, drug abuse TTC, tribal opioid response. If you go under that tab, you will see, I think I've done 3. I've done a really good project director one, I've done a really good outreach, and a good family coordinator one. In fact, if you go for the family grant that we just passed, you'll want to take a look at that and then maybe modify it. There are ones you can either type up. I mean, if they're not in Word, maybe you can scan it and redo it and type it up to make sense in your community. But these are very thoughtful. SAMHSA only allows I think a 1-page or 2-page, I can't remember, job description. I think it has to be 1 page. And so I put all kinds of things in about cultural relevancy and making sure that you're using a collaborative process, making sure you're getting good consumer input, making sure you're reviewing your project for effectiveness, and making project corrections midstream if you're getting feedback that the program isn't as good as it could be. All the things you would really want in a thoughtful job description. So feel free to beg, borrow, and steal any of those job descriptions. Also, you can Google on the internet. I found really good job descriptions just Googling, and then I'll edit it to make this. I very rarely start with a blank page. There's usually not enough time. This is a good time to find an evaluation partner if you don't already have one, whether that's a university or a consultant or somebody who, a graduate student who's going to help you gather data. Anybody that you would normally work with, this is good. You want to get all those relationships figured out when you don't have a grant deadline looming. You want to do this now when you're in the easier part of your life. And then this is a good time to establish collaborative agreements. There's really no mystery here. If you know, for example, that you, and I'm going to make up this example, that you have a priority in your tribe of working with pregnant and parenting women, let's say that's your #1 priority, you should get to town right now creating relevant job descriptions, relevant budgets. What would a program that you would want to have look like? How much would it cost? Create a sample budget. You can tweak all of that to map into the actual grant when it hits the street and you have time to apply, but you'd much rather be editing and tweaking than starting with a blank page. So these are very consuming things, time consuming things to create. And figuring out who your collaborative partners are is really key. Even if you don't establish the MOUs with them, to at least figure out who's there, who would you speak with, what's the phone number, the contact information, any footwork you can do in advance. I also like to monitor trends and priorities. I look at legislative trends of whatever state I'm in or whatever local government I'm in, or your tribal governments. I'd look at the federal government. Like right now, we know exactly what the trends are because of COVID. We know that everybody and their brother has gotten have such mental health challenges dealing with the isolation that occurred because of COVID. So we know there will be a ton of money coming out. There already is starting to come out money, and there will be much more to address mental health issues among all populations. And those mental health issues may look very different, whether they're kids or whether they're adults or whether they're older people. And so now's a time, since that's coming, if that's something you need, to start learning more about, well, how would you go about that? One of the things, if you're working with kids, to know is that the kids have not only lost out a little bit academically because the online schooling typically doesn't work as well as in person, but also they've missed getting that critical feedback from their peers. Now that could be good if they were being bullied. Maybe they've missed that bullying, and that's a bullet dodged for sure. But they may have also missed that helpful peer interaction that kind of lets them know what the norms are, what's okay, what's not okay. So they may have really missed some growing up opportunities. But anyway, you can kind of plan through, you look at what suicide risk is. People are using drugs alone, so you have more unintended overdose. You can look at what these trends are, things that are happening. We know that criminal justice reform is big. We know that diversity and inclusion is big. We know that there's some things bubbling up now, long overdue, that we will start to see more of, and should be very helpful in your planning. Think about also what are your competitive advantages and disadvantages? What kinds of, if you want to plan to be able to match funds, looking at how you would go about doing that. This is a lot of like homework cycles of things that you can do. Do you have any essential people you need to get with, tribal leaders? Do you need to bolster any, your data systems? Whatever you need to do to kind of readiness, this is the time to go. Now, I always recommend writing before the opportunity hits the street. This right here is a very typical format for almost every funding opportunity you can apply for will follow something like this. They might have little different words, whether it's CDC, the Centers for Disease Control, whether it's, Administration of Children and Families, SAMHSA, Department of Justice, Department of Education. Almost every funder, even the private ones, want to know, why do you need this? Sometimes they'll call it a statement of need. Sometimes they'll call it, the needs section. But they're going to want to know something about what is your problem, or sometimes they'll call it problem identification. And then who is that affecting? And we call that your population of focus. Try not to use the word target population. That's kind of out of politically correct. It's not politically correct anymore to really talk about targets. And that's not a real safe word. So we go with population of focus. So, you might right now, after this session, or whenever you have your next time, your little free time, which might be never, I realize, to begin writing up some very descriptive information about the needs in your tribal community. And, what data do you have to support that? And who is most affected by that? Sometimes as a grant reviewer, and I don't do that, I don't review anymore, but when I was a grant reviewer, I would read a needs section, and they never even mentioned who they were going to focus on. So it wasn't clear, is the tribe or the organization saying that this problem that they've discussed and the needs that they've discussed affect everyone equally? Or are there certain subpopulations or populations of focus that you want to drill down to, that where this issue of substance use or whatever, pregnancy, whatever you're writing a grant for, might affect a little differently? So generally, there's never enough data. This is unfortunately the first section of every grant. And if a grant reviewer tells you that they don't make up their mind about funding a grant until the very end, most of them are not being honest. You pretty well know by the very first section whether this grantee is even in the ballpark of being a good contender for this grant opportunity. Yeah, you may decide at the very end, but you're already making some opinions about this based on how strong they come in their first section. So as we'll be discussing throughout the training, this first section is absolutely key. So then, so what's the problem you're identifying or the need that you have, and who are you going to focus on? And then this next bullet, well, what are you going to do about it? What are you proposing to do? What is the approach that you plan to take to address that need or that problem and that population? By the way, sometimes these are separate sections. You may have statement of need, Then the next section of the grant might be population of focus. So sometimes they're pulled together, sometimes they're not. We'll talk about them either way. But this proposed approach is where you basically say, what are you going to do about it? And this is sometimes where they'll say, tell us what evidence-based or effective practices you're proposing. What are you proposing to do? Then we go to organizational, and by the way, sometimes that, if it's about evidence-based practice, you're in luck, because a lot of the evidence-based practices have been written up and they're in public domain language, which means you can literally cut and paste a great deal of that right into your grant with very little rewriting, because they're describing, you know, the trauma-informed program, or the, you know, motivational interviewing, or contingency management, or, you know, whatever the particular project or program is. Usually it's been written up and well described, so you're not reinventing the wheel there. This next bullet is where I see a lot of mistakes happen in grant writing. Organizational capacity. This could be your tribal organizational capacity and your proposed staffing. Sometimes these are also two separate sections. But what happens is, keep in mind that whoever reviews this grant will not, and we're going to take a break here in just a few minutes, but will not have any idea who you are. So they don't know whether or not you've got the capacity to pull off this grant or not. They don't know whether you've ever implemented a suicide program, or an HIV program, or a homeless program, or whatever it is you're proposing to do. And they don't know whether you have the workforce that has the current skill level to do that job right out of the gate. So if you are cutting your teeth, so to speak, on something brand new, then you really have to be careful how you approach this section, because you may kind of lose a little credibility right out of the gate. And it may be that you should be partnering with somebody with a little more experience, at least in the beginning, even if they kind of back out over time and then your organization or tribe comes in heavier, maybe in year 2, year 3. But most funders, unless it's a brand new topic area, something that's brand new to everybody, most funders don't like to bet on a horse that they think isn't going to cross the finish line, or if they just don't know. Now, let's say you are new at something, but you've implemented some other federal grants really well that were maybe similar, then that's the case you're going to make. Maybe I'm new at this, but we have a really solid track record over here doing something that's substantially similar. And then, of course, you make that case. And proposed staffing, you know, you never want to have all to be hired, to be determined. And we'll cover that in a few minutes. And then, of course, the performance measurement or evaluation, show us how you know it's going to be effective, and then your budget, and then there's always appendices. So I want to stop there and just check in with my hosts here to see, were we planning a break at all, or what is your preference?
Well, it's your voice that has the strain, so I suggest you take a drink of water and everyone can take a breath.
I've got that right here.
Perfect.
And we go until 3, is that correct?
Nope, we go until 1, your time, 2:30. So it's
Okay, I had it on my calendar till 3, and I think that was just for any wrap up. So then I'm not going to take a break. We're going to just go right through. I'll have a sip
45 more
of my orange juice, if that's okay.
Yes. I was gonna say, Ayanna Smith, I have sent you in the chat, and maybe you haven't seen this yet, the 3 documents that I sent everyone else this morning. So if you wouldn't mind sending me your email, I'll make sure to email these to you next time in the future.
Excellent. Okay. Okay, so what we're going to do now is we're going to briefly cover these key sections, not all of them, but many of them, because remember, we're in pre-application. Right now, we don't even know that any funding's come out. What can we do to kind of get ready for the big day when the grant announcement comes out? So how I've structured this course is to give you kind of a, 1,000-foot overview of what we're going to do here, and to give you some food for thought and some examples. But then in the following modules, we will go in and start actually creating some of the narrative. But I didn't want to go in cold and do that. I wanted to show you some examples of how we do this. So the first thing you want to do is start identifying your needs and sources of information. So whether you're going door to door, whether you're sitting down with tribal members, whether you're porch visiting, whether you're putting out a survey on SurveyMonkey, or you know, putting out some kind of survey in your community and offering a prize for, you know, maybe their name gets entered into a drawing and, you know, they have a shot at getting a prize if they contribute some information. There's lots of ways to get information about a need in your tribal community. But however you do that, don't forget how important testimonies are. I really like the idea of surveys better than just raw data, because data tells you something, but it doesn't always tell you why. So data may say, you know, if you read, let's say somebody else did, let's say the Centers for Disease Control did some kind of survey, and they told you that, you know, I'm making this up, that 15% of all teenagers are using opioids. And that's not a true statistic, I just made it up, but let's say you read that survey. You could potentially apply a percentage like that against your teenagers in your tribal community to see, well, how many would that be, and where are these teenagers living, and what might we do to address that? But if you had an opportunity to collect that information in another way, you could maybe find out a little more. Well, like, well, what kind of opioids are they using? Are these pills that they're stealing from their, you know, older family members that might be on pain meds? Are they getting heroin? Are they getting something off the internet? You know, you might, these in-person, or the, you know, where you're doing these like groups, allow you to kind of delve in a little deeper. I do recommend, if you're going to do this, that you have somebody who's like an evaluation professional, maybe work with you to help structure the questions to make sure they're not complicated, or you're not asking too many things at once. But anyway, I like this idea that when you look at a problem, you look from multiple levels. So if I were to be looking at substance use in a tribal community, I might interview my tribal leaders and elders to see what are they seeing? What do they see as the priority? What would they like to see for a solution? Then I might want to interview the complete opposite end, people who are actually using, people that are in treatment, or people that are out on the street that haven't gotten to treatment yet. I might want to interview family members. What's it like to live with someone with a substance use disorder? What do you think is needed? What do you see as the problem? So you look at law enforcement, maybe interview people at the emergency room. What's coming in your door? What, you know, and there are ways to collect these data in multiple formats. But at any rate, we'll talk more as we go. I'd also find out any data at all that exists about your tribal community on the topic that you're wanting funding for, whether that's pregnancy prevention, STD, sexually transmitted disease prevention, drug treatment, you know, whatever topic you might be interested in, suicide prevention. Also, there's lots of other data like waiting lists. If you know that there are treatment programs or prevention programs, but there's waiting lists for people to get in, you want to document that. So just imagine a file cabinet and you were shoving in every piece of data you can find, every, you know, on the topic of interest to you, so that when the grant award comes out, you can move very quickly. And you'll want to make sure that those data are updated. If it's data that comes out every year, that you get the next year or the next year. I do like to keep old data because I like to also look for trends to know if it's going up or down. So these are just some examples of the kinds of data you might look at: opioid overdoses, HIV, hepatitis, health disparities. You know, there's so many different kinds of data you can look at, but it needs to be relevant. So, you know, you would want to pick your topic also of what you really want to prioritize in your area to look for funding for. So you already know a lot that you can start writing, right? You know about your tribe, you know how many members there are, you know their ages, you know your geographic boundaries, you know, so all of this can be described. We always go from the big to the little. So you might talk first about the state or the region that your tribal community is in. Or if you're an urban Indian tribe, you know, where your members are scattered, or if they tend to coalesce in certain areas, and you describe this. Maybe you describe some strengths, you describe some hardships, you know, And then you continue to boil down to your population of focus. So maybe you drill down a little more if you're going to focus on youth and describe everything you know about youth, or if you're going to deal with older adults, talk about that. So you go, start writing all of these compelling information.
Pam, can I ask
Yeah.
a question?
Yep.
Amy asked a question. Have you used newer technology to capture data?
Yes, there are all kinds of new technology like geomapping. I think I have an example I'll show you in a few minutes where that is tremendous. On the portfolio, I've worked in with tribal communities for about 20 years, but I tend to work with mostly small rural tribal communities, and most of the tribes I work with don't have budgets for some of that technology, so I always focus on the simpler ones. But yes, there's absolutely, and in fact, throughout this course, I'd love to set a time where we can hear examples. We can probably do that starting next week to see what examples you might want to offer, and certainly put anything like that in the chat box. I'm not good with monitoring chat while delivering. I'm not a good multitasker, but I know we've got, folks, Megan in particular, but also maybe Kate, who are monitoring that. But please share if you have some, because the geo maps and like show the hot spots and mountains of problems and molehills of problems and strengths, and it's pretty cool, some of that technology. Very important to describe any barriers. I was having a discussion, I was in Montana having a discussion about a barrier to treatment. This is right before COVID. And somebody told me, oh my gosh, we have to take a bus and we go all the way to this treatment program. And it's 120 miles. And in my head, 120 miles was a 2-hour drive. And I said, oh my gosh, that's such a long drive, 2 hours. And they looked at me like I was from Mars. And they're like, oh no, it's a lot more than a 2-hour drive. And they started describing this rugged terrain. And I've had some of the Alaskan tribes and villages describe what the rugged terrain is. Don't assume that the reviewer of these grants knows that. So, paint that picture for them in this description. And you may have way more text than you'll be allowed to use because of the parameters of the limits of space. But I'd rather be where you have it all written down really cool, and then you go through and edit to get into your limits if need be. If you have a strategic plan for your tribe, by all means, reference the strategic plan. And that's because that lets the reviewer know that your tribe is taking, a painstaking process of identifying needs, identifying gaps, identifying resources, plugging along in a forward motion, trying to address them. Now, if the topic you're wanting to write the grant on is not covered by the strategic plan, you may want to let the grant reviewer know that you are intending to update or add to the strategic plan this particular focus area if it gets funded. That lets the reviewer know that this is being memorialized. That there's some structure to this. This is not a one-off or a one and done that you're asking for funding for, that this will become part of your portfolio, so to speak. I'm going to show you an example. We're going to go really quickly through these because you'll have this to read in more detail. So let's take a sample, a hypothetical sample. Let's say you've got a tribe in New Mexico that decides they want to seek a mental health funding grant for children in their tribal community. So I'm going to give you a bad and a better example. Okay. So this is a weak example. In a national survey of exposure to adverse childhood experiences, 11% of children were found to have experienced 3 or more ACEs, the adverse childhood experiences. And these ACEs have a tremendous impact on future violence, victimization, perpetration, and so forth and so on. And I reference CDC 2011. And so because of this is an important public health issue for our tribal community. Well, this is a very weak statement of need. Let's look at a stronger one. A survey administered to more than 1,300 Native Americans from 7 New Mexico communities, including our Gallup community of focus, identified ACEs, as this issue. 29% of these local folks surveyed found this, found that. You see a needs assessment 2018. And then on top of that, you know, Native youth and young adults are even at higher risk. And we led a focus group with these Native youth. And this is what we learned, that they had these barriers and challenges, yada, yada. So you can see, and just in case you missed it, what contributed to the weaker versus stronger example. The weaker example, we were vague. We used national stats, not local. Our statistics were old. They were from 2011. You're really not supposed to go back more than 5 years, but obviously you want to use the most recent possible. And if for any reason your data is old and that is the most recent, then please tell the grant reviewer that. Don't assume that they know that. Put an actual parentheses that said, most recent data currently available, so that they know you know that's old, but it's the best you have. Also, the weaker example didn't drill down to the population. It talked in general terms, whereas the more relevant example, stronger one, had Native specific data. It supplemented with community level data. It had some focus groups that you took the time to ask real people what their needs were. It was from 2018-19, and you even looked at some specific barriers. So anyway, I'm going to go through more quickly here. Just know too that when you're writing needs, that there's there's so many ways to slice and dice or dissect a subpopulation by gender, by whether they're two-spirited, gay, lesbian, transgender, by age, by their language needs, by cultural distinctions. There's so many, you know, by rural, by urban, by rich, by poverty, by strengths, you know, what strengths can be built upon, resiliency, you know, so really drill down when you describe these populations more richly than just numbers. Consider using charts and graphs, consider comparing, and consider powerful quotes. I'm going to move a little quickly now because I know we're getting close to the end, but also because I'm going to show you some examples. This is a way to literally take a particular geographic area and identify hot spots. And so these were some surveys around pregnancy, and it showed where there are two communities where these young girls were getting pregnant left and right. And so we showed the reviewer where they were by creating this map and then coloring it in. And then we took an arrow in case they were confused and said, of all the red hot spots, this is where we're going to focus our need. And then these are some, and the reason I'm going through quickly is we're going to do this again in more real time in future sessions. But know that when you discuss the proposed approach, so now we're on that kind of second section, you've described the need, who you're going to serve. Now, what are you going to do about it? Remember that many funders ask you for this right here. Why did you pick it? Did you randomly pick out of a hat that you were going to do motivational interviewing or contingency management or some kind of trauma-informed therapy? It's not enough to pick it and describe it, but why did you pick it? What happened in that needs problem ID section of your grant informed your choice, you know, or the focus groups that you did, you know, what, so try to link your need and your problems to the approach you've selected. There's some really clever ways to do this. And hopefully, again, during our next session, we'll have plenty of time for folks to share what that was. Also, fidelity monitoring is often, if you're going to implement a particular evidence-based approach, somebody ought to be popping in periodically to make sure that model is being implemented properly with the right sequence or the right type of you know, approaches, and so that you're delivering what you said you were. And it's not enough to, if we build it, they will come. This is a huge need in the proposed approach section. Usually, it's not enough to say we're going to serve X number of people. Well, how are you going to identify them? How are you going to approach them? How are you going to refer them? How are you going to get them in the door? How are you going to keep them in the door? So those are like the gory details that a lot of people leave out and they don't get the good score. So you have to, so thinking now, how would we do that? What kind of outreach? Who will we use to do outreach? Will we use people in recovery? Will we use tribal elders? Will we use people that look like the people that we're trying to attract for services? Also, there's usually some required activities that the funder has said you have to do. And I'm going to show you some clever ways to incorporate those in your narrative, either next week or the week after. I can't remember. I think it's next week. And you almost always have to do a timeline chart. So why not start those now? Why not create the timelines now? This is a week approach where they're very vague. I'm not going to read it all. You can do this because you've received this. But it's very vague. And we're just basically saying, you know, we're gonna work in this facility. We're going to serve this many people. And we're going to use this program. Instead, here's the stronger example. This is the program we approached. It was adapted from another Native project. This is why we selected it. This is where we're going to implement it. It's going to be with these kinds of youth. It's been proven effective already, and so forth and so on. And you can again read this at, and then how many youth we're going to serve, what % we think will be male versus female. A lot of this detail is left out of the grants that I've reviewed over the years. And I review a lot now, not formally, but in the grants, the programs I work in, I get copies of that grantees will send me, and I see lots of missed opportunities to really like be specific and be very detailed. So anyway, you can read these at your leisure. And, but I also want to show you that this is a very clever format. This is a little complicated, this chart. If I had it to do over again, I would make it simpler. But what you can see is the dark blue column shows the population of focus. What is in this case, the population we were proposing to serve had post-traumatic stress disorder. They had a high degree of depression and anxiety. They had a lot of externalizing behaviors that they were exhibiting in schools. And they had lots of sexualized behaviors, a lot of high-risk sexual activities. So when that was what they came in the door with, or what our data showed we were dealing with, then we went over here to say in the light blue, how does the program that we picked address these needs that the population have? And so, and again, I'm not recommending this particular chart. I'm recommending you format a chart like this, where you succinctly look at what your needs of your population are, and then how does the program or the solution or the framework that you selected address those. Here are some templates that you can begin. This is one way to do a timeline where you have your key activities and you have Q1, Q2, Q3, all the way through. This is a 2-year project. If it was 3 years, you'd run it out 3 years. Almost always for timelines, you have to go sideways. And that was where I was telling you to go with the horizontal template. And I'll show you a couple tricks to that when we're in that module. But I always add milestones to mine, whether they ask for them or not, just because I like to overshoot the runway. But sometimes you're required to have a milestone column. This is my favorite way of doing a timeline, not the one before, but where you actually put your target dates in, your staff, and I always use codes. And I put a key right here. You can see project director, PD, AC is advisory committee or council, whatever it is. And so I like these kinds of projects myself. On the timeline caution, a lot of SAMHSA grants require you to begin service within 4 months of grant award, so make sure that's worked in. A lot of times they'll require you to have a health disparity statement submitted within 60 days. All of those should be in your timeline. And sometimes you can put all kinds of abbreviations and get into that kind of, usually I do a really clear timeline for year 1. And if they require a timeline for year 2 and 3, which is kind of a pain because you haven't even started the program yet, but I'll say, same as year 1 except, and then I put a couple lines in that show how year 2 might differ. And that's just because usually I'm up against a serious page constraint. Or I'll summarize and say quarters 1 through 4 or quarters 1 through 2. I try to, minimize the volume of steps. You can be working on your job descriptions now, your letters of commitment, your sample budgets. You can start creating goals and objectives. I recommend that you take whatever the required activities of a grant are and make those tied to your goals and objectives. If you have to do all that work anyway for the funder, and I'll show you exactly what I mean next week. It's a very clever way to convert a funder's required activities into your project objectives. And I'll show you a one-for-one way of doing that. Also, if you don't have required activities, think about goal themes and keep these small. One of the big mistakes I see is people have 27 goals. You know, you might just need 2 goals and maybe 5 or 6 objectives. You know, the smaller and more focused but logical, the better. And there's some really cool logical goal themes. I'm going to give you a couple, and then we'll be done here today. Remember that even though every funder has a different definition of goals and objectives, theoretically, goals are those broad statements or wishes, and, you know, like to increase access or decrease pregnancy or increase school graduation or decrease dropout. They're large goals. How you get there, whether you're implementing specialized programs, doing outreach, working with families, all those steps that are quantifiable are the objectives and the activities. But goals are usually large, overarching, you know, unless a funder tells you otherwise, which sometimes they do. But here's kind of a cool goal theme example. This is more for prevention. I try to mix prevention and treatment in just to give each, you know, I know I have a different audience here. Some are prevention, some are treatment. But for prevention, you want to assess what's going on in your community. You want to build capacity to address those needs. You want to create some kind of plan or approach to go forward. Then you want to implement that plan, and then you want to evaluate and sustain. You might even have evaluate/sustain. So that's a prevention goal. I'm going to try to see if I gave you one I'll give you one for treatment. Treatment might be, or for services might be identify, you know, the proposed approach, you know, build workforce in collaborative capacity to address, because you want to build your own workforce, but you don't implement programs in a vacuum. You've got lots of collaborative agencies and organizations that you'll probably have to work with. Then you might implement with fidelity, and then evaluate and sustain. So you might think of these kind of ways to group these, the activities that you will be implementing. Let me check time real quick. I know we're close to the end here. Okay, yeah, we're at the end. So I'll stop there. I'll just tell you what you have here to go through at your leisure. These are just some lists of things that you might typically expect, and some wording, just like I gave you in the other one. And we'll go through this in more detail later, but here's some examples of staffing charts, some examples, you know, that you could play around with, and some sample weak and strong examples. So look through those last ones at your leisure, but I do want to show you the homework that's voluntary. You might want to take the links that I provided, including in the handouts. They're the same. What's in the PowerPoint is the same as in the handout, and spend a few minutes trying to find some funding, poke around some websites, and see if you find anything that you think might line up with something you want to write about, a grant that you might want to propose. And then, and if you don't see any of that, but you know, maybe you already have a grant that you've got that you missed, either you didn't apply in time, or you missed, or you didn't submit a strong enough proposal that you want to maybe redo as part of this work we're going to be doing together over the next weeks. You might want to pull that open and look it over, because you will have opportunities to submit work that we can then critique and, you know, privately, and give you some feedback on. So poke around, and appreciate you coming. Are there any questions or anything in the chat box before we close it out for today?
Thanks, Pam. So far, there are no other questions. I think, you know, with the amount of information you deliver in such a short time period, might take people a little bit to work through what they want to ask. So maybe at the beginning of next session, we can ask if there were any follow-up questions.
And I think that's a great idea. And that's what, I know a lot of people think you can do grant writing in a couple hours, and it's all we could do to get it put into 4 hour-and-a-half long sessions. And that's why, you know, we try to do a little bit of homework, and I'm available. You can also email me with questions.
Yes,
Email Megan, email you, and then you can forward them.
either way, yes. If we weren't in a pandemic, you guys, we'd be in San Diego
I know.
for 2.5 days, and we'd have you all with us. So this is what we can do for now.
Yeah, and I hate that because it's so much more helpful in person. Next week, we're going to be covering what happens when the funding opportunity comes in. What do you do? What's step 1, step 2? And we'll start working through an actual grant application. So this was kind of just to prepare you for that and to give some thought. So I appreciate it. And I wish you well, and we'll hopefully see you next time, and bring your friends.
Yes, thank you, Pam. We'll see you guys next Monday at the same time. And I think I'm going to open it up to a few more participants so we can get the most out of this training for everyone that wants this. So there may be more people on next time, but
Excellent.
excellent.
Excellent. Okay. Well, thank you, everybody. Okay.
Thanks,
Bye.
Pam.
Bye.
Bye, guys.